problem of the ophthalmology and to unite and to become one, and to communicate with us the problem and to resolve online, because they are developed country, they have a lot of human resources. The undeveloped country, which has the low economic, they don't have the resources in terms of the human resources and in terms of the eye care services. So if we unite together, so we can resolve some problem, because, for example, in Somalia, the disease which we have, the tropical area, sub-Sahara, it's a different disease which the European and Latin America, because the problem which we have in here is the cataract and glaucoma and trauma. So for us, we need to increase the human resource of our country in Mogadishu, Somalia, and all. So how can we increase the human resource? We need some senior ophthalmologists which can submit to us the lectures of our junior medical ophthalmologists in order to increase their knowledge. And also sometimes we meet some problem which we cannot resolve it. So we need some senior specialist refer, which we have his address and we can ask some questions. This is nowadays the online courses and the online training. It's a better tool instead of some of us traveling. It's better to do like this, to ask what can we do. Yeah,
that's right. So maybe that will be helpful in the future about the digital conferences that it will facilitate online learning and exchange of information.
Yeah, absolutely. Yeah.
Dr. Haye, how many ophthalmologists do you have there in Somalia?
For the last 25 years, after the Siad Barre, 1990, we do have 12 ophthalmologists for the MD, 5 for the MD, and 6 for the master ophthalmology. And we have the diploma, almost 15. We have 28 ophthalmologists, MD, master, and diploma.
Is that enough to treat all of the eye conditions in Somalia?
No. There is a limit, If we compare our population, almost 17 million, absolutely they are different because we don't have enough.
What kind of resources would be good to have in Somalia in the field of ophthalmology if you could have more resources?
The eye care, the ophthalmologists which we have, they don't have mostly the subspecialists. They usually work for the outpatient clinic. So first of all, before we bring the equipment, we need to train our junior ophthalmologists for the subspecialists. And the next, we can order to bring in here the instrument which they will work. For example, LASIK and LASIK. This is what we need. Laser, we have the BRB laser.
Right.
We do have, but only we have one BRB laser. Other instrument like screening for the glaucoma, we don't have the laser for trabeculoplast laser for the glaucoma. Even cycloablation we don't have because mostly they are painful eye. We don't have. Usually we advise to them retropulpal injection for the reduce of the pain. The second, if the pain will not relieve, we do the enucleation. So if we have the cycloablation, we can introduce the ciliary body ablation. So those instruments, whenever our junior medical ophthalmologists to train to subspecialists, the next we can order the instrument.
In Somalia, historically there's been conflict, and that has led to explosions from time to time around Somalia. Can you please state one more time what kinds of ocular trauma you see and how you can help to restore vision of patients in those situations?
Mostly, we see the anterior segment rupture, So the corneal tear and hyphae and traumatic cataract, all they are together, Whenever there is an anterior segment trauma, lens becomes ruptured and rupture of the vessels of the iris and tear of the cornea. This is the most. Second, the explosion, sometimes we see the penetrating trauma for the sclera and posterior segment, So sometimes we see, it's rare case, perforation of the eye, perforation.
Right.
Lost eye and all the things of the choroid becomes out. So it's a rare case, but we saw a lot. It's a rare case. Regarding the treatment, if there is anterior segment rupture, suddenly we refer to the OT and we do the corneal repair. Daily we do the corneal repair 2 or 3. This is not due to the explosion, because the young children, sometimes they play together or pain or stone. So last night I repaired 2 corneal repair. One his age is 7 years, and the other one almost is 17 years. Female, female and male. So the corneal tear there a lot, but this is not explosion. It's a trauma due to storm or young children when they are playing. Sometimes they have the pen and put the eye. So this is daily we see. The explosion sometimes is rare, monthly 3 or 4 explosion, and we.
Well, Dr. Haye, thank you so much for joining us